Hello, and welcome to the first indoor session of the National Press Foundation America's Long-Term Crisis Journalism Fellowship. We have had some really insightful, creative conversations so far. I'm really excited about the prospect of us producing from what we've learned over the past day and a half or so. But this next conversation we're having offers you just an incredible opportunity to think expansively, broadly, and creatively about this issue. But you'll also, I think, walk away from hearing from Jason Resendez with a different level of passion. That's the only word I can share, because I met Jason Resendez on LinkedIn. And if any of you know how to masterfully use LinkedIn, what you need to do is just put in the topics that you care about and curate that so that the people who talk and are thought leaders and really do amazing work on these issues wind up in your feed all the time. And so for the past year, or certainly the past 8 months of working on this project, I've really learned a lot from reading Jason Resendez's LinkedIn posts. He is the president and CEO of the National Alliance for Caregiving. And again, his commitment to equity, to access, to justice for long-term care is simply remarkable. So I encourage you moving forward to follow him on LinkedIn. So Jason, thank you so much for joining us, and we look forward to your presentation.
Wow, thank you so much for that kind introduction and for a plug to my LinkedIn profile. I'm going to advance the slides. Well, as Rachel mentioned, my name is Jason Resendez, and I'm president and CEO of the National Alliance for Caregiving. We are a membership-based organization that brings together over 60 institutions from across society to shift systems to better address the unmet needs of America's family caregivers. We do that through research, through policy, and through system change programs. Okay, here we go. Let me see if I could go. And system change programs. And we do this because caregiving is one of those issues that's fundamental to everything we do. From the moment we take our first breath to the moment we take our last, caregiving is a constant in our lives. In fact, by a show of hands, I'm interested, how many folks in this room have been touched by caregiving in one form or another? Wow. I'm always shocked but never surprised by the response to that question. Because care, like I said, connects all of us, and we all come to care through different ways. I came to care through watching my mom, pictured here, raise 3 kids while working a full-time job and caring for my grandmother, who battled multiple chronic conditions, dynamic, all too familiar in Latino households across America and other households as well. And she did that, she provided that care out of a deep sense of love for her family, for her mother, but also out of necessity. She had no other choice. And that care came with consequences. For her, it meant that she never became the certified public accountant that she always dreamed of becoming. She had to settle for being a bookkeeper, which she's still very proud of, but was a dream unfulfilled. Throughout her life, she's had to dip into her hard-earned savings to make moments possible for her family, like the moment pictured here, my college graduation. She was able to make different choices. I think it would have been a different outcome in terms of the life that she's been able to provide for herself and for her families. But like I said, care has consequences, and she's not alone. For those of you who raised your hand, you're not alone. There are 53 million Americans in this country providing unpaid care for a loved one living with a serious medical condition, illness, or disability, and doing that facing several consequences, which we'll talk more about. That's 10 million more than there were in 2015. And I'll be talking today about the consequences that come with that unpaid family care, primarily leveraging data from the National Alliance for Caregiving and AARP's joint marquee research project, Caregiving in the US, which is a research study that we conduct every 5 years together that looks at the challenges, opportunities, and policies that we need in place to better support America's growing community of unpaid family caregivers. And when we think about the current state of family caregiving in the US, we know that it is becoming more and more complicated due to a number of factors. One, we know that family caregivers are caring for more people than they have been in the past. And the people that they're caring for are living with more multiple chronic conditions, for example. Caregivers themselves, over a third of family caregivers are dealing with 2 or more chronic conditions as they're navigating care. We see that care coordination is becoming more and more difficult. Over a third of family caregivers report that they find difficulty in coordinating care for their loved ones, which is up from 2015. And I find this really fascinating because when we think about the number of apps and number of resources available to help support care coordination, we talk a lot with innovators in the space developing mental health apps, care coordination apps, team apps, scheduling apps, which has really blossomed over the last 5 years. But when you look at the data on coordinating care, we're not seeing a population level impact in the development of those individual apps. Certainly there are individual stories, but it speaks to a deeper issue when it comes to supporting and investing in care coordination. We also see that 40% of family caregivers are in high intensity care situations. We measure this by the number of hours of care provided on a weekly basis, the number of activities of daily living, instrumental activities of daily living, and complex medical tasks provided. So the more activities you're supporting, the more hours, the higher intensity care that a caregiver is in. And that high intensity we find to be associated with harsher economic consequences and harsher self-reported health consequences. And not surprisingly, the folks that find themselves in the highest intensity care situations are often people of color, particularly women of color. So we see inequities and when it comes to not just intensity of care, but also care coordination. If you're a woman of color providing care for a mother living with Alzheimer's disease, that care coordination is extremely difficult, more so than individuals providing care for someone living with a less complex condition. So in sum, what we see is that caregiving is becoming more prevalent, more complex, more intense, and more inequitable. And these trends have consequences like the ones I talked about for my mom, and I want to explore those consequences. When we think about this from a healthcare perspective, we see that one of the key consequences of unpaid family caregiving is the impact on the family caregiver's own health. We see that the self-reported health is getting worse over time. More individuals reporting that their health is worse due to caregiving in 2020 than in 2015. And while it percentage-wise, is not a shocking number, that's still 12 million Americans who say that their health is worse due to the unpaid family care that they're providing. Unpaid care that for many of them, they have no choice in providing. It's not surprising when we think about contextualizing this data, it's folks who are spending over 8 hours a day providing unpaid care, juggling multiple medical tasks, multiple activities, daily living. Where is their time to prioritize preventative health services, for example? Where is their time to exercise, to eat healthily, right? So all of those things have consequences when it comes to an individual's self-reported health. We see this also when it comes to emotional distress. Nearly 40% of unpaid family caregivers report high emotional stress due to their caregiving. This is related to things like feelings of isolation, for example. So the emotional impacts is something that we see across all different kinds of care. So whether you're providing dementia care, you're providing transplant care, you're providing cancer care, we see emotional distress as being a key hallmark of unpaid care, particularly high intensity unpaid care. Now there's some interesting, when you dig into the data, some interesting facts that we'll talk about here in terms of ways to perhaps ameliorate this emotional stress. And then one of the key drivers of caregiver hardship is the financial impacts associated with care. Almost half of family caregivers report at least one negative financial impact due to caregiving. That it could include stopped savings, going into debt, letting bills go unpaid, and nearly over a third experience at least two or more financial impacts due to caregiving. Not surprisingly, this is regressive with household income. So the less a family makes, the more intense those financial impacts become. That is also true when we look at the intersection with household income and race, where women of color are particularly feeling the brunt of the impacts, the financial impacts of family caregiving. Yet, despite all these challenges, all of the hardships associated with care, the healthcare consequences, the financial consequences, the mental health consequences, over a half of unpaid family caregivers report a sense of purpose and fulfillment from the care that they provide. This is something certainly in the case of my mother. It was a cultural honor to provide that care, cultural expectation to provide that care, but that also came with a sense of personal fulfillment because of the innate value that is seen in that care amongst caregivers. And when we look into the data, we see that this sense of fulfillment is perhaps a buffer to some of the other issues that we see. So for example, women of color have the highest rates of fulfillment when it comes to providing care. And we see that despite all of the things that we mentioned earlier, higher rates of self-reported poor health, higher rates of financial impacts, women of color are more likely to report lower emotional distress when we see higher emotional fulfillment. So there's a buffering that happens when we think about the impacts of emotional fulfillment and addressing some of the other issues. It speaks to a sense of resiliency in caregiving. And it's this resiliency that we think at the National Alliance for Caregiving as an advocacy organization that we have to invest in. Right? We have to invest in caregiving infrastructure to take advantage of and to cultivate that resiliency, to make caregiving more sustainable, more dignified, and more equitable. And when we think about, well, what does it take to make caregiving sustainable? What does it take to make it equitable and dignified? We ask family caregivers. We ask them about the kinds of policies that they want to see to help address the challenges that they face and that we face together as a caregiver nation. And what we see is that overwhelmingly folks want financial infrastructure, policy to support the work of caregiving, right? Because just because unpaid care is unpaid doesn't mean it's not unskilled. Doesn't mean that it doesn't have tremendous value. In fact, research from AARP, which I'm sure you've either seen or received or will hear from, puts that value at north of $600 billion annually. So it's clear that there's financial value to that unpaid care. We're not investing in and recognizing in that financial value through our policymaking. So when we ask family caregivers what do they want to make care, to recognize that care, we see over half want things like tax credits. Caregivers spend about $7,000 on average out of pocket on care-related costs that are not tax deductible. We see that they want overwhelmingly at least some a pay for the care that they're providing. This is higher among women of color, particularly Latino women, who really want to see some form of financial remuneration for the kind of care that they're providing. And over half of caregivers want to see policies like paid leave or flexibility at work. Over 61% of unpaid family caregivers are providing that care while employed. And over 50% of those employed caregivers are working full-time while providing care. And they're doing this in a country that doesn't have a national paid family and medical leave policy, forcing caregivers to make really difficult decisions between putting food on the table and being there to provide the kind of care, the quality of care that they want and that their loved ones, family members, friends, community members need and have come to rely on. So when we think about, well, what progress are we seeing? What is the infrastructure that we need to better support these caregivers? We're seeing some incremental progress. Paid family and medical leave, for example, while we are still one of the only nations or nations with a developed economy without a national paid family and medical leave policy, we're seeing more and more states take action to support paid leave from a medical perspective and from a family care perspective. In the last 2 years alone, we've seen several states take on and pass these policies, which are extremely popular with family caregivers, and particularly women voters, demonstrating the power in family policy, in caregiving as an economic driver, an economic security policy. And what we see is when you look at the research, right, most of the research on paid family leave is really oriented towards parental care. But we're seeing as more states establish more comprehensive policies and we dig into the impacts for family caregivers of older adults, family caregivers of people living with serious medical illnesses and chronic conditions, what we see is that it's increasing availability to provide family care. It's where the effects that employers are worried about are not really manifesting, right? We see affinity, like when folks take advantage of that paid leave policy, they're much more likely to come back to that employer than to leave the workforce and find another job or a different kind of job. And we're also seeing that it's improving earnings for women over time. So after that leave is utilized over time, it's helping to increase wages and decrease gaps. And so it's while the data could be stronger, right? If we had more data, if we had more states doing this, if we had national data. But when we look at the data that is available, we see that it's a promising policy to support care across a lifespan. We've also seen one of the products of the pandemic is just a really interesting and innovative use of American Rescue Plan dollars to better support unpaid family caregivers at the state level. This has come in many forms. In some cases, direct cash assistance to family caregivers. In some cases, better access to programs and things like respite care, training. Different states have done different things. We've seen, for example, 39 states have used American Rescue Plan dollars to provide direct financial assistance to support unpaid family caregivers. A lot of this has been in response to the shortage of direct care workers, and I'm sure that's a big topic that you've been discussing and will discuss throughout this summit. And so some states have recognized, well, unpaid family caregivers are doing this job and can help to buffer the impacts of that shortage, so have created new pathways, primarily through Medicaid waiver applications, the abilities to support financially family caregivers. Unfortunately, with the end of the public health emergency, of those 39 states who have extended those programs, only 20 plan to continue and sustain those programs. So while progress has been made, it's been fragmented and underscores the need for continued investment at the national level in addressing these issues. When we think about national level action, national level leadership, there's obviously continued mobilization and advocacy in support of many of these individual policies, but we also now, for the first time, have a national strategy to support family caregivers. And just curious, how many folks in this room have ever heard of a national strategy to support family caregivers? Other than Sarah, because she wrote a great piece about this for the 19th. Wonderful. So, it's starting to get out there, right? We think this is an important milestone because it shifts the conversation from who are family caregivers, what are the things we can be doing to support family caregivers, to here is a blueprint that outlines actions at the federal level, 350 actions at the federal level, 150 actions at the state level, to start advancing the administrative level actions and also elevating the policy ideas that need to advance in order to support and address a lot of the challenges that I outlined. So it's not a silver bullet, right? Well, there are a lot of criticisms of the national strategy, but it does represent for the first time a foundation for mobilization, for continued pressure on federal agencies and on the federal government and elected leaders to continue to prioritize and strengthen supports for unpaid family caregivers, and we'll talk a little bit more about the progress that we've seen since the release of the national strategy in just a little bit. But for those of you who are unaware, it has 5 goals. So those 5 goals really are structured around all of the challenges that I mentioned earlier, and underscores and frames out what 17 federal agencies will do in support of these family caregivers. So something that continues to represent an opportunity for federal leadership moving forward. However, a national strategy is only as impactful as its implementation. That's why the National Alliance for Caregiving launched the Act on Raise campaign, which is a campaign that brings together over 80 stakeholders at the national level, at the state level, that cut across the fields of aging, patient advocacy, disability, and caregiving to continue to put pressure on the government and on policymakers to put into action what's written in that strategy, and to continue to mobilize the resources needed to put that strategy into place. We are continuing to raise visibility of the strategy, shape the narrative around the strategy, and start to elevate and advance the policy ideas that are outlined in the strategy, including policies like paid family and medical leave, stronger supports and investments in home and community-based supports, among many others. And when we think about, well, what is the impact of the national strategy? What have we seen over the last year? So September, this past month, was the 1-year anniversary of the release of the national strategy. And since then, we've seen, I think, incremental progress, but really some key milestones that the strategy has helped to catalyze. One, we've seen $20 million invested in implementation of the national strategy. When the national strategy was released, there was no new resource associated with the national strategy, which is one of its biggest criticisms. It's great to have a piece of paper, but we need money to put it into action. And many of us have been singing that song and getting others to do the same. And we're excited to see an initial investment, which is a drop in the bucket, but is a down payment on future action to implement the national strategy. We've also seen philanthropy step up. According to a report from an organization called Grantmakers in Aging that looked at philanthropic support aligned with the actions in the national strategy, we've seen over $100 million invested in grants, whether they're direct service grants or advocacy grants, aligned with the goals of the national strategy to support family caregivers. So we're certainly seeing it as a catalyst for new resources to invest in and support family caregivers. We've also seen some tremendous action at the executive level. An executive order released. That was the first ever executive order ever released on family caregiving that outlined 50 actions, and caregiving more broadly, that outlined 50 actions that directed agencies to advance administrative policy, including better access to respite services, better access to beneficiary health information through Medicare. But more than anything, it set the tone. It set a new sense of urgency to agencies to be innovative in supporting caregivers across the lifespan. And those agencies have started to respond. We've seen 2 new rules proposed by CMS, one an access rule on HCBS that addresses things like the amount of wages that go directly to a direct care worker, for example, and then also just recently a proposed rule that would for the first time create 2 new reimbursement codes for training family caregivers. So it's created, if enacted, healthcare providers will be able to be reimbursed for training unpaid family caregivers. We think this is really important. We've been championing this kind of policy change for quite a while, because if you look back at the data around care coordination, around the number of activities of daily living, around high intensity care that's often associated with caregivers who are providing care for individuals with complex needs. So individuals living with Alzheimer's, with cancer, for example. And what we know from our data is that despite being in these highly intense roles that require training, over 70% of unpaid family caregivers had never had a conversation with the healthcare provider about how to better provide that care for their loved one. So there needs to be an incentive, there needs to be accountability, but this is moving us in the right direction to incentivize the health system to better integrate caregivers into care teams. And that's actually goal 2 of the national strategy. So we're excited to see administrative action take place to bring to life that goal. We also saw the announcement of a new council. So the national strategy is overseen by a council of a mix of federal representatives, family caregivers, and subject matter experts from across society who come together to advise the Secretary of Health and Human Services in the development of the strategy. This is important because it means that this is an ongoing process. Right? Caregiving is, my background is in patient advocacy. I come from the Alzheimer's community. We're trying to cure Alzheimer's disease. We're not trying to cure caregiving. You're never going to cure caregiving. We're going to make it more sustainable. We're going to make it more equitable and more dignified. And so we will need a national strategy to support family caregivers for the foreseeable future. So the launch of a new council really represents continued stewardship of this national strategy. And with the addition of our advocacy campaign, we see an injection of accountability that provides the framework and groundwork for, I think, accountability and sustainability moving forward around federal leadership in support of unpaid family caregivers. And that brings me to the end of my presentation. Happy to take questions and be in conversation around these issues. Yeah, so I spent the last 10 years of my career at an organization called Us Against Alzheimer's, a patient advocacy organization that was founded by 2 philanthropists who had a family connection to Alzheimer's and recognized the need for a more aggressive approach to championing federal funding for Alzheimer's, and also to advance visibility and solutions to address the inequities that we see in Alzheimer's. So my specific role was leading the first ever Latino coalition focused on Alzheimer's. So Latinos are 1.5 times more likely to develop Alzheimer's than non-Latino whites. And the impacts of that disparity ripple over into family caregiving. So it was one of the first ways, other than seeing my mom's role as a caregiver, which at the time I didn't conceptualize as caregiving until I was in the Alzheimer's space and really started to understand from a policy perspective what caregiving was, and from a research perspective what caregiving was, that, oh, hey, that was part of my story too, and the story of the 11 million Latinos providing care in this country.
Before I open it up, I also would like to ask you about something that I've been running by all of the speakers since last night. We were privileged to hear from Deborah Whitman and Susan Reinhardt. And I asked them last night, it just seems like so many of these policies are common sense. I mean, if as a functioning society or humane society, it would seem to me that creating these kinds of resources would be a no-brainer or whatever. And they mentioned the issue of competing interests. Mm-hmm. Particularly when it comes to lobbying, and one industry saying, we don't want that because it'll take away from our benefits. I really feel like we have a really high-level opportunity to hear from someone who can help us unpack this issue of how these policies that every human being needs, why we're fighting so hard to get them to happen.
Yeah, wow, that's a big question. But I think it really does come down to competing interests, and also how particularly issues related to caregiving intersect with so many other issues that are stigmatized. So I think one of the biggest benefits of the Build Back Better stalled effort was that for the first time we saw care issues framed as economic security issues and not just family issues, not just women's issues, even though we know they are, and that's important. And but to see it framed as, yeah, it's that, but it's also economic security. It's also, we need that in order to, I think there was a quote that some folks need bridges and roads to get to work, and some folks need caregivers to get to work, right? They're all intertwined. And so that narrative shift is, I think, really critical and underscores the road ahead that we have with these policies. Is how do we start to reframe them around being these essential economic issues and these central social issues. One of the things that we hear all the time in talking with family caregivers is the sense of guilt that they feel, right? Like, I wish I had gotten a better job. I wish I had planned for this. I wish I had stopped at having one kid. I mean, just the most intense emotions associated with their inability to provide care. But what that underscores is that there's this sense of personal responsibility and a lack of acknowledgement that this is a societal issue. We all rely on care at one point or another, right? This is a society failure, social level failure. And so it's that reframing that I think needs to happen with some of these issues, and then creating that power base around these issues to advance these policies.
That's an important point, the power base. Who has the power? Who has the microphone? Who has the ability to gather support? Let's open it up. Are there any questions? Wait for the mic and...
Hi, good.
Thank you. I actually have two questions. One, I thought it was interesting the stat you had mentioned. Oh, I'm Kathy Ritchie from KJZZ in Phoenix. The 51% of people surveyed were given a sense of purpose for their caregiving. I was curious, are those individuals who are caring for family, or are those DCWs? And is that at home or like in a long-term care setting? So I know families play a huge role in supplementing care.
Yeah, great questions on the nitty-gritty of caregiving in the U.S. So the caregiving in the U.S. data, all the data that I just presented is on unpaid family caregivers. So it does not include folks who are in the direct care workforce. It also includes folks who are providing the majority of that care in a home-based setting, and not in a setting that might include assisted living or a more institutionalized care setting. And
I know you talked about sort of the societal failure. I was really curious to know who's doing it right when we look at other countries. Like who's somewhat successful? I can imagine this is, it's affecting other countries and who's doing it well and what are they doing?
Yeah, I think that's an interesting way of thinking about it. I think there are a lot of countries who are more advanced in addressing some of the deeply entrenched issues that stand in the way of us really investing in care. So I think one of those issues, and it also kind of dovetails on what you're talking about, is ageism, right? How do we care about an older and aging population? We see countries like Japan who have done a really progressive job in thinking and reorganizing society around aging and community level supports around aging. From a policy perspective, we see Canada, for example, has a lot of the policies that we're talking about, yet we do a lot of work with the Canadian Centre for Caregiving Excellence, because they talk about, we have a paid family leave program, but we don't conceptualize support specifically for family caregivers. So they're looking at our national strategy as a blueprint for the work that they could do in Canada around specifically calling out caregivers as a population. The UK has done a really progressive job or a comprehensive job in thinking through caregiving, particularly caregiving across a lifespan. They've done a great job conceptualizing different pockets of caregivers, like young caregivers, for example. There's a lot of visibility of the role of young people in providing care in the UK, and also policies to better support those caregivers. You're welcome.
Any more questions? While you're thinking about it,
I see a hand over
Oh, okay, great. Sorry.
Hi, I'm Thomas Hughes, Bay City News. Thank you for this talk. You mentioned it took you a while to come to the realization that you were a caregiver for your mother. I know I've heard that too in my reporting, and I wonder, the 53 million statistic, does that include any of those people? Is there any rough estimate, any data ballpark about how many people in America are caregivers, but they're not registering that? And for the outreach component, what sort of informational awareness can we bring to communities to let people recognize that what they're doing is caregiving?
Yeah, no, that's a really important issue that we're all trying to grapple with. And starting with caregiving in the US, what we see in our data over time is that we're increasing visibility of caregiving. And that's like collectively as a society, we're doing that. If you watch This Is Us, for example, beautiful themes in caregiving. The first time I ever saw caregiving on in the mainstream media was in Friday Night Lights, where one of the characters is caring for his grandmother who's living with dementia, and they go through her diagnosis. So there's great examples of how over the last 5 to 10 years, we've significantly increased visibility in the role of unpaid caregiving. Part of that has been accelerated, particularly as it intersects with the direct care workforce during the pandemic. What we see in our data, we think that one of the reasons why we see that jump from of 10 million additional caregivers is that more folks are self-reporting that they're a caregiver, sort of a greater self-awareness because of that collective work that we're doing. But we know that there are many, many more who see themselves just as, I'm a daughter for my that's what my mom was. My mom saw herself as a daughter for my grandmother who was fighting these multiple chronic conditions. So she didn't talk about herself as a caregiver. So there's work that we need to do around conceptualizing what care does. I think we have a stronger foundation to do that now. And that's one of the goals of the national strategy. Goal one of the national strategy is around increasing awareness so that more folks self-identify as a caregiver. But we need to put in place the infrastructure to make that identification more valuable, right? Sort of particularly when you think about that within an employment, over a third of family caregivers have never told their employer about the fact that they're a caregiver because they're, one, afraid of being discriminated against at work because there's no supports in place to support that identity and that identification. So we have to put in place the infrastructure alongside creating that visibility so that it translates from visibility into support into sustainability.
I guess I think that hits right on. I was going to follow up maybe, but I think you just covered it as far as people not recognizing themselves as caregivers versus sensing the barriers and challenges of it and not wanting to. Is there reluctance you're seeing? And you mentioned it with the employers, but maybe any other areas where people kind of don't want to accept that that's the commitment that they're going to make and the implications maybe about their work or about other stuff. I mean, and you say the infrastructure in place can help that, but are you seeing a significant reluctance to even identify as a caregiver?
Yeah, we see, I think it's a third, I'll have to get back to you on the exact data, in caregiving in the US of caregivers who report they had no choice other than to take on this role. And what we see is caregivers who report saying they had no choice often face deeper disparities when it comes to financial impacts, to emotional distress, to isolation. So certainly there is that reluctance related to a number of factors that we haven't delved deeply into because we're really looking at this at the population level. But anecdotally, we see that it could be related to the lack of support from other folks in a family, not wanting to prioritize other parts of your life, because caregiving can change your trajectory completely when you take on that role. So we certainly see that playing out in our data and in the role of caregiving.
I want to ask you about a conversation we had this morning about the workforce. And we heard from Hammy Tierson, amazing discussion with lots of context and insight about the overall issues. But what I found most interesting was the thread on professionalizing the long-term care workforce. As I have stated and as I see it, historically, it's just seen as this inexhaustible supply of Black and brown women who need the money, will accept lower wages, and if you lose one, there's 12 others standing behind who will help you take care of grandma. So can you help us explain the need to provide pathways to careers, to make this field, the workforce, much more sustainable?
Yeah, absolutely. I mean, I think we think of them as the two sides of the same coin, right? When we think about how do we make caregiving, unpaid caregiving, more sustainable, part of that includes having a more valued direct care workforce, right? A direct care workforce where folks can earn a living wage and have a career mobility. And I think that there are lots of ways of doing that. And I think one is you talked about pathways. We think about this from the perspective of the unpaid family caregiver. where we know during the public health emergency, so many family caregivers stepped up to address that shortage and sort of taking on those skills, and we're starting to get reimbursed for it. We see that through consumer-directed programs across the country. We think that there should be a sustainable pathway. There should be more investment in helping caregivers, family caregivers who see this as an opportunity to provide that care and receive value, to have that pathway. But there are so many barriers to consumer direction across different states. We've heard there was a great Washington Post piece a couple months ago that talked to a family caregiver who said, I qualify for this program, but I can't afford the 2 background checks that it takes to qualify for this payment in my state. And so there is a fragmentation of policy related to how to take advantage of these programs. Yet we have this amazing community, right? The 53 million are folks who have provided care in the last 12 months. That's how we look at how the data is generated. But you have so many caregivers who are no longer providing care, but have this very valuable skill set. I remember talking with a young caregiver who her father was diagnosed with early onset Alzheimer's when she was a freshman at University of Virginia. And it went from navigating financial aid to navigating Medicaid. Like, how am I doing this for my family? And she was a first generation American, and so she was helping to navigate this translation from English to Spanish, and she did it beautifully. And she did it out of love, and she did it applying the skill set that she developed getting into UVA, one of the most competitive universities in the country, to helping her father navigate this diagnosis and this condition. And then when he passed away, she talked about, what do I do with these skills, right? I see other caregivers. So we think there's an opportunity to look at how we develop and leverage this skill set that former caregivers have to help address this shortage of support and expertise through things like caregiving coaching. Right, sort of really looking at how we can be innovative in conceptualizing the roles and profession of direct care across different needs and different skill sets. Right, how do we really look at this expansively, like we do in other areas of the economy, like coding and things like that, right, where you could get a more vocational areas. So I think there's a lot of innovation to be had to help us address this direct care workforce issue, but that can't get away from, we need to make these jobs that are, have a living wage, that have mobility and have pathways to a dignified profession.
Kathy has another question, and then we'll go to Alex.
I was curious because I'm glad you brought up the conversation about the caregiving from the individual from Nash Peaks. What I think is interesting coming from Arizona, and I know PHI recently came out with a report, I think, on this, like we were talking about when I interviewed Kezia. This idea of you have this undocumented group of individuals, and I know at NASHP it's not something that doesn't seem like at a federal level, like no one's interested in having this conversation, but it seems like a no-brainer to me because in my experience, pretty much everyone that was working at a facility was, had come from someplace else. What are you looking at this? Like there has got to be, like, I don't know how you report on it other than saying like, hello, we have this obvious workforce and we need individuals to provide this kind of care. We need help. What are your thoughts on just the reporting? Like, how do we tell this story? How do we illustrate this story? I mean, is there anything a state could do, like a border state like Arizona, to how do I illuminate this conversation? Because it's like, hello. Yeah. And I don't think I'm doing a thorough job. So I'd love your thoughts on that because we're not talking about it. And I know it's political too.
Yeah, it's we all know it's a very political issue, but one that needs to be part of a conversation, right? Like all options need to be on the table as we start to address this shared challenge, this shared crisis that touches all of us at what point. And so, immigration, I think, is a really important issue to look at. I think one way of telling that story is we know that lots of family caregivers are already tapping into that market, right, informally. There's a huge gray market for care from undocumented individuals. So I think that's one way to tell that story, is that there are plenty of folks who are already, it exists. Those pathways exist. They're just happening informally. The Domestic Workers Alliance Caring Across Generations has done a great job conceptualizing this as an issue and starting to tell those stories, particularly where those stories have become exploitative, right? Where you have folks who've brought in undocumented immigrants and they're exploiting them for their care, right? Sort of not withholding their passports, withholding wages, and threatening to call immigration services if they raise an issue. So the consequence of not addressing this political issue and looking at this as the policy opportunity that it is this exploitation. So I think those stories are out there, certainly can be told, continue to be told and elevated, but I also think there's examples of where that is happening in a way that is working for folks, and it would work better if there were those formal pathways and policies in place.
Alex, I'm with NBC News, and thanks, Jason, for coming. I had a question. One of the most surprising pieces of data that you presented from the Caregiving in the U.S. study is around the purpose and the percent of those who are finding purpose and fulfillment in this role. What surprised me about the stat that you brought up was that there's around 10 or so percent who are finding this not to be fulfilling at all. Can you talk about why folks might be feeling that way? What are some of the contributing factors that led them to say that? And also, what are the things, whether it's policy-wise or in terms of any kind of culture shifts that might need to occur for more folks to join that 51% plus who are finding a tremendous sense of purpose in this work?
Yeah, absolutely. So one, I think when we think about those folks who are not finding this fulfilling, there are a number of factors. One, including whether they had a choice. They felt like they had a choice in taking on that care, how isolated they feel. So the more sole caregivers of someone are more likely to say they're not fulfilled. The more folks say that they didn't have a choice in taking on that care are also less likely to say that they feel fulfilled from that role. So when we think about, okay, what do we do to invest in that fulfillment, that resiliency? One, it's an area from a family caregiver research perspective, it's completely underinvested and underexplored, sort of that resiliency factor. And so that's an area that we've been championing to look at, right? We need to look at not just the challenges side of it, but sort of what are those cultural aspects and resiliency aspects, because they do, we suspect, help to ameliorate some of those other issues like emotional distress. So from a policy perspective, things that we can do to invest in resiliency, we think are things that are going to make care more sustainable. So making it easier to balance your care with staying in the workforce and having professional fulfillment in addition to fulfillment at home. So paid family and medical leave, being able to have access to home and community-based supports, right? So that you're part of a team, sort of that helps address this isolation issue. It helps to address a choice issue, sort of being part of a network, a care network can help address those issues. So a lot of the policy issues are these bread and butter care issues, these economic security issues that we need to have in place in order to make care more sustainable. And you see that resiliency hopefully go up.
Could you talk a little bit about, I'm Marquita Brown. I'm a freelance writer and editor based out of Northern Virginia. And would you talk a little bit about how the refusal to expand Medicaid in some states factors into maybe the increase of unpaid family caregivers, and what is being done to support those caregivers maybe in those states and advocate for them?
Yeah, that's a great question. And I just did a PBS show called Flatlands, which is a Missouri, Kansas City-based show. And that's one of the things we looked at was, you have Missouri, who's expanded Medicaid, and Kansas, who hasn't, right? And Kansas City kind of rides both those lines. And it is these states that have expanded Medicaid that we also see leveraging things like Medicaid waivers to leverage dollars to better support family caregivers, whether that's through training. Like Maine introduced a $2,000 grant to provide or direct payment to family caregivers that they could use to do things like cover respite care or meet other financial needs, which is really innovative. We see in New Mexico taking the same route in terms of leveraging their Medicaid waiver to create pathways to directly pay unpaid family caregivers. And in those states that have not expanded, we don't see that same level of innovation. We don't see that same level of intentional structure around supporting family caregivers in the same way. Oklahoma did just recently introduce a state-level caregiver tax credit. So they're looking at it in different ways, but one of the biggest issues with caregiving is that in order to better support care, you have to have access to quality healthcare, right? Or the healthcare impacts, the impacts on helping a loved one better access, a chronic condition or aging. Sort of that health infrastructure is really critical and intimately tied to the hardships of care. That is better supported in states that have that robust healthcare infrastructure.
I want to ask you to expand a bit on the whole resiliency piece and the mental health piece. I personally believe that the bottom line in all of this is families reaching a breaking point, families being unable to continue the care because of the emotional drain. And so too often people think that if you have a lot of money, this issue is going to be a piece of cake. Can you help us put into proper perspective the need to understand the overall emotional toll on America that this issue is having, or will have?
Yeah, our data underscores, right, that over 40% of caregivers experience high emotional distress due to care. So it certainly has a mental health impact. That's intimately tied to feelings of isolation, right? Feeling that you're the only person providing this care. Folks are not engaged in care. We even see that in so many instances at the family level, where certain family members step up and certain family members don't, and that contributes to that emotional distress and mental health impact. And then also, as we think about this really important and urgent movement around mental health in this country, we're doing, I think, a really good job in some communities elevating the importance of mental health, and a really bad job in other communities. Caregiving is one of those, right, where we're not conceptualizing. The Surgeon General recent report on loneliness, for example, I encourage you to read the caregiver section, and you'll understand what I'm talking about, right? It very much downplays.
Familiar with, I'm sorry to interrupt, the Surgeon General's report on loneliness in America and the impacts. Check it out.
Yeah, so there's a section in it that's couched as caregiving, but it primarily, and it includes a line, this is meant for caregivers of parents, of children, and really not looking at the 53 million folks in this country providing care for a loved one living with a serious illness, chronic illness, or disability. So there's just a lot we need to do from a movement around mental health to include family caregivers in that conversation. The same as we think about it from a disease-specific perspective, right? So a lot of folks' interaction with care comes through this lens of a diagnosis, right? But so many folks are not diagnosed, and there's a barrier. I know that intimately well coming from the Alzheimer's community, where that's one of the biggest disparities is around receiving a diagnosis for your loved one living with dementia. So what do we do in order to create services and supports from a mental health perspective that go beyond the current infrastructure? So there's so much that we need to do. I think the first thing we need to do is recognize that caregiving has really harsh mental health impacts, and we need to build around that.
Are there any other questions? Yes.
Hi, I'm Nina Keck with Vermont Public. Just a quick follow-up to the mental health point that was just made. Do you hear about efforts is it a state thing where people are trying to funnel more resources to encourage therapists and counselors who have an expertise in gerontology or caregiving?
Yeah, I think that's fantastic. I mean, I think that's a really important move in the right direction. In fact, one of the many positive things that we saw in this CMS proposed rule on caregiver training services was around how CMS defined a provider, and it included therapists. So it would increase reimbursement for providers, including therapists, to support the family caregiver in addressing their mental health needs, as long as it was tied to a treatment plan for the beneficiary. So that's still, one of the things that we have to address. But I think increased incentives and training for therapists, for providers, community health workers to support the mental health of caregivers is a step in the right direction.
We are coming to the end of our time for this session, but I wanted to ask you to do something that I try to ask all of my speakers to do, and that is give us one or two topics or stories that you would like to see next week in the paper, on the radio, wherever these outlets these journalists come from. What would be a couple of really important stories that you think need to be produced right away?
Yeah, I think one, I really am interested in this immigration story. I think that sort of really looking at how this is happening in a positive way, being able to juxtapose those two, underscoring that this is like an urgent issue that has a solution. It could go one way that's really positive, or it can go one way that's very negative and exploitative. I think that's an interesting one. The other is one that we are dealing with every day, and I don't know how to address this, is how we define caregiver, right? It's one of those issues that, when we think about it culturally, it's one of those issues that's like, oh, do we really need to address this, right? Like, I'm going to use caregiver this way, I'm going to use caregiver that way. What's the consequence of not adopting a term around caregiver, except one of the benefits of increased visibility on family caregiving and caregiving challenges is increased policymaking around caregiving. So we see, for example, these proposed rules, and the national strategies define caregiver one way. FMLA defines caregiver in another way. This proposed rule defined caregiving in a way that said this benefit is going to be applicable only to the unpaid family caregiver. Well, what does that happen to Gloria, who was in the story that I was in Kansas City, who receives $500 a month through the Medicaid program to provide care for her mother? Is she unpaid? No. But is it a profession? No. Right? So does that sort of movement at the state level to provide reimbursement or financial support to caregivers preclude them from new benefits that are emerging? So there's more of a need now than ever for us to get clear around terminology and caregiving, and what are the consequences? What is that gray area around how different the state level, at the federal level, we're defining caregiver, informal caregiver, unpaid caregiver. It's this patchwork that has a policy consequence to it.
I think now you can understand a bit why I stalk Jason on LinkedIn. But more than that, I think I appreciate particularly someone from your generation, I'm assuming you're
a millennial,
taking leadership in this issue and really modeling what is needed for us to draw a consensus around the fact that as a country, we simply have to start doing better. We have to start acknowledging the crisis. We have to start responding in creative and innovative ways. So thank you so much for taking time out of your busy schedule to come and speak with these journalists. I think we need to show Jason our appreciation for him joining us today.
Thank you. Yeah, I appreciate the kind words, and I appreciate you including caregivers in these conversations, like the focus on the unpaid family caregivers. And I think one of the reasons why we see that visibility is because more stories, whether you're reporting on dementia, you're reporting on cancer, is including the perspective of the family caregiver. And I think that needs to be something that we continue to do. So thank you for doing that.
Well, we will continue to call on you at NPF, and I'm sure the journalists will want to reach out to the coalition as often as they can. So thank you.
Thank you.
So much.